Hey, if you're like most Americans, you have dealt with low back pain in the past. In fact, you might be dealing with it right now. It's a matter of fact that low back pain actually affects more people on a regular basis than most other aches and pains combined. So it's a really big deal. What I want to do in this video is walk you through some of the different causes of low back pain, and really one of the main ones that you may not realize what it really means until you get some education behind it. So that is a herniated disc. So I'm sure that you've heard that before, or you've heard of disc bulge or some sort of terminology similar to that. But I'm going to show you in this video what that really means and if it could be potentially what's causing your low back pain. So what we want to see in a spine is a bone, a big fat healthy disc, and a bone. And that goes all the way up and down the spine. This is just a segment of it. And the reason that we want to see that is because that's what allows the bone to move. Is if you have that big fat healthy disc between it, it acts as a cushion between the bones. You can bend side to side, you can bend forward, and all the bones move properly. That allows that motion of the spine, and it allows you to do the things that you need to do. But what can happen is due to trauma, maybe it would be a car accident, it could be a fall, it could be some sort of sports injury. The bones can actually go out of alignment, they can get stuck, they can get fixated and restricted. And when that happens over time, that disc actually starts to shrivel up because it's not being used. So here's a segment of the spine that would be similar to that. You can see here that we still have the bones, but between we have a much smaller disc space that's actually started to shrivel up. Some of the fluid has come out of it, and then, as you can see, it just doesn't move as well either. Now what this can cause over time is something called a disc bulge or a herniated disc. And what happens is the fluid from the very center of the disc, and in this model it's this red stuff on the top, that can start to come out of the disc. So I think the best way to describe the disc is like a jelly donut. There's that fibrous outer part, which would be like the dough, and then inside would be the jelly. That's exactly the way that a disc acts as well. So what happens during a disc bulge or a herniated disc is that that fibrous outer donut part becomes weak, and then that jelly essentially just pops right out. And that's what we're seeing in this model with this little red piece here. That's that disc fluid coming out. That is a herniated disc. Now, that's all fine and dandy, but essentially the issue that this causes is that it puts direct pressure on that nerve coming out of this area. So in between each of the vertebrae, we have a nerve that comes right out of that area. It controls all the different muscles, all the different organs in our body. So if you're having a herniated disc coming out right where that nerve is, that's going to cause problems to wherever that nerve goes. And most of the herniated discs happen in the low back or in the neck. If you are having that in the low back, that's going to cause things like low back pain. It can even cause numbness and tingling pain all the way down the leg into the ankle, into the feet. It can cause problems beyond just the low back because that nerve distribution goes all the way down the leg. So hey, if you are potentially dealing with some sort of low back pain and you're wondering if it's caused by a herniated disc, come on into the office. We can certainly help you out. We are at Deep Roots Health Center. It's just south of Rainbow Curve in Bentonville. But if you got something out of this video, make sure that you comment, tag, or share below, and I will catch you on a future video.